Hi, my name is Jennifer Gunn, and this is my presentation on my IRB proposal, selenium and non-ischemic cardiomyopathy. Selenium is a trace mineral that is essential to several processes in the human body. Selenium is present in the soil, and humans absorb it through the foods we eat. Plants grown in areas of the world where soil selenium levels naturally have lower levels of selenium, which translates to deficiencies in the population consuming that food. Selenium is metabolized through digestion into proteins, which have many different functions in the body. Some of these processes are thyroid function, muscle development, and cardiac support. Selenoproteins have roles as antioxidants in glutathione paradoxate, GPX, which supports phagocyte cells in cleaning up waste in the body. The RDA for adults is 55 micrograms daily, which is often able to be consumed through the daily diet. Cardiovascular disease is the number killer of adults in the United States. There are multiple forms of cardiovascular disease, different risk factors, and different pathologies. The form of cardiovascular disease we are focusing on for this presentation is non-ischemic cardiomyopathy. Cardiomyopathy refers to the condition of the heart muscles becoming damaged, to become stiff, thickened, and/or enlarged. Ischemic cardiomyopathy is when reduced blood flow causes the cardiomyopathy. Non-ischemic cardiomyopathy is when the damage to the heart muscles is not the result of reduced blood flow. Non-ischemic cardiomyopathy can have multiple causes, but selenium deficiency has long been suspected to be one of those causes. Instances of direct selenium deficiency and non-ischemic cardiomyopathy. The first documented cases of Qishan's disease were found in 1935 in Qishan province in China. Qishan disease causes myocardial necrosis and fibrosis and primarily affects women and children in poor rural areas of the country. Severe selenium deficiency was found to be the culprit, and those diagnosed with Qishan disease responded to selenium supplementation. Intestinal malabsorption and non-ischemic cardiomyopathy. There have been multiple cases of patients living with malabsorption issues such as Crohn's or ulcerative colitis becoming selenium deficient. These patients then have been seen to develop non-ischemic cardiomyopathy. In one case, a child who was on parenteral nutrition due to severe food allergies developed cardiomyopathy. Upon further examination, he was found to have developed selenium deficiency. Once the selenium deficiency was treated, his cardiomyopathy resolved. Selenium and selenoproteins play antioxidant roles in the body. Selenoprotein therapy was shown to reduce oxidative stress and inflammation markers in obese women and in another study, elderly adults with cardiovascular diseases. This selenoprotein therapy was shown to reduce mortality rates from cardiovascular diseases up to 10 years after the selenotherapy protein took place. The hypothesis developed for this IRB proposal is as follows. What is the occurrence of selenium deficiency in patients diagnosed with non-ischemic cardiomyopathy? And can supplementation help reverse and/or treat that non-ischemic cardiomyopathy? Study design. Participant selection. Adults between ages 18 and 80 will be selected. This will give us a chance to look at non-ischemic cardiomyopathy through many age and life events. Study participants will be referred by their cardiologists to the study. They must be diagnosed with ischemic cardiomyopathy. Other cardiovascular diseases will be ruled out for this study. A minimum of 186 participants are needed. 200 will be recruited to account for dropout rates throughout the study. The participants will be divided up into two groups. One group will receive selenium supplementation of 2 micrograms daily, and one group will receive a placebo pill. These groups are randomized. All participants will be known only by a randomly assigned number, and the control group and the intervention group are randomized. Lipid panels and mineral panels will be done 3 times during the study: at the beginning, at the middle point, and at the end of the study. This will allow us to look and see how serum levels of selenium and also cardiomyopathy markers in bloods will change throughout the study. Will be interviewed about the physical manifestations of their cardiomyopathy. These can include symptoms like fatigue, breath, during activity or during rest, swelling in the lower extremities, palpitations, and chest pain. These interviews will also happen 3 times during the study, beginning, middle point, and end, to be able to assess if their cardiomyopathy symptoms have changed over the course of the study. At the beginning of the study, patients will undergo an in-depth lifestyle, personal health, and risk assessment questionnaire. And also that questionnaire will be asked for where in the world they lived throughout their lives, to be able to assess if any of the participants had previously spent time in areas of the world where selenium soil levels are particularly low. The data gathered from this randomized control trial will need to be analyzed. This primary experimental study will generate both qualitative and quantitative data. Quantitative data includes the actual blood serum levels of selenium and how they change. Qualitative data includes the interviews on the subject's health history and cardiomyopathy symptoms. Quantitative data will also include anthropomorphic measurements to help give a baseline of health at the beginning of the study for each participant. Blood tests include lipid panels to assess cholesterol levels, C-reactive protein levels to look for inflammation, and finally a mineral to assess selenium and other mineral deficiencies. These panels will be taken at the beginning, middle, and end of this 6-week study in order to assess if at all and how participants' selenium levels and lipid levels change throughout the study. Questions for future studies on selenium and cardiomyopathy include what is the prevalence of selenium deficiency in the average population versus what is the prevalence of selenium deficiency in patients with cardiovascular disease? Are there other micronutrient deficiencies that correlate with this cardiovascular diseases and/or non-ischemic cardiomyopathy? And are diet interventions as effective as selenium supplementation in non-ischemic cardiomyopathy with related selenium deficiency? I hope you enjoyed my presentation. Thank you.